In this tutorial, we'll discuss with you guys diabetes in a little bit detailed way and in a very simple way. What we need now from you guys is concentration. Just concentrate whatever I speak, just look and focus that. You will get the entire discussion in a very simple and easy way. So let's get started from the very first point, diabetes. Well, before moving towards explanation, let me tell you people about the points that I'm going to discuss with you guys in today's lecture. First of all, I'll tell you people what is diabetes. Then I will talk about the introduction or the definition of the diabetes. After that, I will talk about the etiology and pathophys. Types. Then I will talk about the types. Then after that, we will talk about the signs and symptoms, diagnosis, and at the end, we will talk about the management. So let's get started from the very first point. That is diabetes. What is diabetes? Simple. First of all, let's know the term diabetes. This is actually the combination of two terms. Like dia is one, betes is another term. So when you just take the meaning of these two terms, what will you get? Dia means to go through. Betes means honey. Means like when you say sweetness, to go through sweetness. When there is an increased sweetness observed in the blood, is actually diabetes. In short, what is diabetes? It is actually the combination of two terms. Dia is one, betes is another. Dia means to go through, betes means honey, to go through honey. Now this name is given because when you check the blood or when you test the urine of the patient or the blood, you will find sweetness over there. Anyways, in short, there is actually increased glucose level in the blood. Because of that, this name was given. I hope you got. Coming towards the introduction or the definition of the diabetes. Now, how to define or how to introduce diabetes? Very simple. This is actually the metabolic disorder characterized by abnormality in carbohydrate, fats, proteins metabolism. Very simple and interesting. What happens in diabetes? Your carbohydrates, fats, and proteins metabolism is actually disturbed. Simple. It is a metabolic disorder. This is the definition of the diabetes. If someone asks you what is the definition of diabetes, very simple. Metabolic disorder. It is a metabolic disorder in which what is seen, in which the carbohydrates, proteins, and fats metabolism is actually disturbed. Now, another is etiology, and one can say pathophys in short, in a brief. Okay. So what is seen here is actually there is a disturbance in the insulin homeostasis. So insulin is no more homeostatic. Now, according to the types, we will explain in short, in brief, in the types also, this etio and pathophys. So giving you a briefing according to the insulin homeostasis, what is seen in diabetic patients, we know this point very well that the pancreas is responsible to synthesize insulin, mainly the beta cells. What happens in some patients, the beta cells are actually destroyed. Okay, there is destruction of the beta cells observed in some patients, whereas in some patients the beta cells are okay, but the receptors in the body which are responsible to function through the insulin, then the insulin is no more going to function on those receptors. So you can say the receptor sensitivity is actually somehow decreased in some patients. Okay, so what happens again, in short, there is a kind of disbalance being seen or observed in the diabetic patients. Now this disbalancement is of the insulin. So in short, insulin is actually the responsible factor or the cause of the diabetes. Well, according to the types, we have 1, 2, 3, 4 types. There are so many other types available, like Modi and Lada, etc., etc. I'm not going in depth of all. In short, what is the reason? Because I'm not going in depth. Very simple reason. All these are actually for the sake of understanding, but again, at the end, when we understand, so our logic of management will come to these two types: insulin dependent, non-insulin dependent. One can say, in short, basically we have two types. The rest of the types which are discussed in some books by some people, by some teachers, are actually for the sake of understanding, for the sake of classification. And again, telling you again this point that this entire classification is just coming up towards these two types at the end of the day. So basically we have two types. Number one, insulin dependent diabetes mellitus. Number two, non-insulin dependent diabetes mellitus. And the third is gestational diabetes mellitus, and the fourth is pre-diabetes mellitus. Now what is seen here in gestational, we know when a pregnant lady is there, she becomes diabetic. Now what is that reason behind? The reason behind is actually told by some books is that progesterone is the main cause again for the diabetes in the females. Which females or which women? Pregnant. Pre-diabetes is actually observed in all. This can also be called pre-diabetes because when pre-diabetes is not treated, it can come towards the type 1 or type 2 in most of the cases. Now coming towards the IDDM, that is insulin dependent diabetes mellitus. What is seen here, the name is telling you guys, insulin dependent diabetes. Such kind of diabetes in which insulin is dependent, means in which insulin is necessary, that is depending upon the insulin. Now why this is depending upon insulin? Very simple. Remember, IDDM is also called as type 1 diabetes mellitus. What is seen here is very simple. The beta cells of the pancreas, they are actually, if you talk about the percentage, guess what? We have 100% beta cells. Now out of this 100%, 90% are actually destroyed, and the remaining 10% is synthesizing insulin. Now this 10% insulin is not sufficient to work properly in the body. So what happens? A condition is actually seen, diabetes, and this condition is actually called as insulin dependent diabetes. Why? Because insulin is not sufficiently available and is not sufficiently synthesized by the body. Why? We got the concept that in the insulin dependent diabetes mellitus, the pancreatic cells like beta cells are actually destroyed. Majority is destroyed, 90%. According to some books, it is 80 to 85 and 90. In short, a very big portion of the beta cells are destroyed and a very small portion is remaining, and that is synthesizing insulin, which is not sufficient. So that's why we need insulin. That's why it is named as insulin dependent diabetes mellitus. I hope you got the concept. And again, in the same type 1, we do have two more types, or one can say two subtypes of the type 1. Type 1 has two subtypes, 1A, 1B. Type 1A, type 1B. Now what is type 1A? We got here the concept that the beta cells are destroyed. So now this destruction is actually done by the immune system. If the destruction is done by the immune system, if this destruction of the beta cells of the pancreas is done by the immune system, your immune system destroys, autoimmune destruction if is done, then that is known as type 1A diabetes. And type 1B is idiopathic. In this case, immune system or the immune process is not observed. Some other perspectives are actually being suggested, like genetical factors. So that's why such patients in which there is no any immune response or immune process observed, and they do have type 1 diabetes, but they don't have the destruction of autoimmune process, means in those patients there is type 1 but the immune cells are not seen, then we call those patients, or then that diabetic is actually known as idiopathic diabetic. Okay, that is idiopathic, and this is very rare. If we again come towards the percentage, so we will get 95% of the type 1A and the remaining 5% is of the type 1B. So very rare case, very rare. If you don't remember the percentage, it's okay. Just remember that 1A is actually the majority of the cases being observed. Patients are actually 1A, type 1A patients. And whereas type 1B patients are very rare, these are actually 5%. And at the end of the day, management is the same for all, one can say. And there is actually, according to the patient, management changes. So both the types, insulin dependent diabetes mellitus, subtype A, subtype B. So what we got the concept, there is actually insulin dependency being observed, means insulin is not sufficiently synthesized. Coming to the next one, non-insulin dependent diabetes mellitus. The case is obvious and very easy. This is not depending upon the insulin. What is seen here, very simple. We have pancreas, P for pancreas. They are secreting insulin. Insulin is normal and okay. But what is seen on the cells, there are receptors for the insulin. Those receptors are not responding to this insulin. means one can say that insulin sensitivity is actually decreased. And what will happen then? Again, insulin is available, but the metabolism is actually disturbed, and insulin is not doing its job. If insulin is not doing its job, what will happen? Then the glucose will remain in the blood, will not be internalized into the cells. And one can say the metabolism will be disturbed of the carbohydrates, proteins, and fats. So this is all about, in short, about the types, etio and pathophys in short, being discussed here. Now let's come towards the signs and symptoms. Remember, several types of signs and symptoms are actually observed or seen, but the very main and prominent, important one should learn signs and symptoms like polydipsia, polyuria, and polyphagia, ketoacidosis. You guys must keep this in mind for all. We do have some other signs and symptoms, remember. And regarding diagnosis, how to diagnose? Very simple. We'll take the blood, we'll check the fasting blood sugar, random blood sugar, oral glucose tolerance test, HbA1c. And remember these values also. Like in fasting blood sugar, if the level is more than 126 mg per deciliter, the patient is diabetic. And regarding random blood glucose, if it is more than 200, diabetic. And oral glucose, again, if it is more than 200, is diabetic. HbA1c, if the value is 6.5 or higher, the person is diabetic. Now, sometimes, any important point that I'm adding right now is, sometimes you might be asked in exams, in Viva or somewhere, that the value is 126 mg per deciliter. Now tell me or convert this 126 mg per deciliter into millimole. Very simple formula. Just remember and keep this in mind. How to solve? You have the value that is 126. Now you need in millimole, so you must take this value and divide this by the molecular weight of the glucose. Now what is the molecular weight of the glucose? C6H12O6. When you sum up together, you will get the value that is 180. And you must multiply this by 10. Now where the 10 comes from? Deciliter. What will you do now? Very simple. Just cut the values. 0 with 0. And again, cut them all together, 18, 1, and 7. This is just actually a random one because I know the value. That's why I'm doing it in short and quick way. Anyways, you will get 7, the value. When you cut this out, when you sort this out, and when you do the solution of the calculation in an easy peasy way. So what will you get? You will get 7 at the end. So 7 millimole is actually your answer in millimole. This is 126 mg per deciliter. This is equal to 7 millimole. I hope you got the calculation. So what we got here in calculation, just recapping once again, revising for you guys, how to calculate or how to convert mg per deciliter into millimole. Take the value, the result that is given to you or that you get through the testing, that is 126. Just write 126 and calculate the molecular weight of the glucose, that is 180. So take the result, divide it by 180 and multiply with the 10. 10 is actually deciliter. So we want to convert into millimole. When we just go through the calculation, at the end we'll get the value that is 7 right now for our this calculation. So this is actually the millimole. This is how we convert mg per deciliter into millimole. I hope you got the concept. Coming towards the management, how to manage diabetes mellitus. So very simple management, just concentrate. Nutrition, exercise. Remember, around the globe, whatsoever the diseases, in majority cases, nutrition plays a very important role in treatment. And the same is the case of exercise. These two entities play a very important role in management of the body or of the disease. Well, then we come towards the medication. And in medication we have insulin, biguanides, sulfonylureas, tyrosine diones, alpha-glucosidase inhibitors, then we have DPP4 inhibitors, and at the end we have SGLT2 inhibitors, a transporter inhibitor. Remember, these all are actually medication, and their mechanism of actions and subtypes or sub-medication available in each class have been discussed in other video. You can search that video of ours. I hope you got the entire concept. If still you have confusion anywhere, drop in the comment box, and thank you for watching.